Hi, this is Dr. Sunny Kim coming to you live from Las Vegas, Nevada at the 11th Annual International Cell Surgical Society meeting. And I have here with us our very special guest from Jointech Laboratory. And I want the world to know about the advanced adipose stem cell technology that you have available today. Thank you so much for being on with us.
Thank you.
And can you share with the audience about your technology, what it's all about, and what makes it special and unique in the regenerative medicine space?
Absolutely. First of all, thank you for this opportunity. I'd love to tell you more about minitc, which is an FDA cleared medical device for processing lipoaspirate, which means adipose tissue, down to the level of microfat, and as well as it can give you SVF, right? So it's a closed loop disposable system, comes as a kit with the device and all the disposables that are needed for the lipoaspiration, including the cannula, the syringes, and for the final injection. So the way this works is you collect the lipoaspirate as part in a clinic, no need of an operating room or a surgical setup, no need of a lab, everything gets processed within this single device. So it's a closed loop, single processing device unit that comes as part of a kit. The lipoaspirate, when you have it, it gets injected into this device through these lever locks. You don't need to open anything up, and that's why it's a closed loop system. We give you a small centrifuge that works with this, so you have 2 spins within this system to give you microfat in about 30 minutes. And you can inject it back right away in a patient setting. So all in all, it takes about an hour and a half for the patient to walk in, get the lipoaspiration done, and processing within the device and the injection. So the patient walks in and walks out. The applications are a lot in the musculoskeletal space, joint injections, pain management, aesthetic applications, plastic reconstructive surgery applications as natural fillers for the usage of microfat. Now in Europe, this device is CE mark approved as a dual function device. It can do microfat, as I just explained, in the 30 minutes, but it can also do SVF within the same setting, within the same device in 90 minutes. So now extending in from the microfat version where you have the microfat here in 30 minutes, you would add the enzyme within the same device, have a shaker incubator used for about 30 minutes to dissociate the cells, and then do one-step centrifugation process and have the final SVF pelleted in this device here with about anywhere between 20 to 40 million cells from the adipose content we have here. So it's the best in class, the only dual function device on earth which can do both microfat and SVF. The microfat being so fine, it can be injected with even a 24 to 25 gauge treatment with the micron level that we get following the processing. So I think it's a very useful device for a lot of applications within the regenerative medicine space. Very unique device, as I said, because it's a dual function device, and very intuitive device for the physician, for the medical technician who's operating the device.
Awesome. Now, would you not say that is the future of medicine?
Absolutely, yes. And there's more and more evidence in regards to the usage of microfat, stem cells from adipose tissue for a variety of clinical applications. And this device just makes it much more easier for physicians to use it in practice in the clinic.
I think this is a great concept, and I think this is going to be an international hit.
Absolutely.
Thank you
Absolutely.
so much for educating us.
Thank you.